Hello dearies, how are you doing? I hope you're all doing wonderfully well. In today's video, we are going to talk about salaries. Yes, I've gotten a lot of questions about the salaries of different types of health workers. Some of them comparing like what's the salary is a PA physician assistant salary more than a nurse's salary, pharmacist PA, like we you just want to know, which is okay because when you are deciding to get a job, you have to look at what that job will pay you so that you know if you can survive in that job. Okay, you need money to survive in today's world. And I've gotten a lot of questions that if I want to respond to one after the other every day, I have to create videos on salaries. So in today's video, we'll look at the single spine salary structure and what everybody gets based on their qualification, okay, at the entry level. So we'll focus only on the entry level because it's after the entry level that promotions, upgradement and all will come in, and you will know what you will get after each promotion and conversion or upgradement. So in today's video, I just want to give you a general overview of what you can expect depending on the type of program you are doing. So before we get into looking at the figures and co, one thing you should know is that the government of Ghana uses the single spine salary structure to determine the salary of each employee in the public service, okay? And because of that, the base pay that you get or that we get is based on your educational qualification, okay? And so that means that the higher your education, the higher your salary will be. That is that. Hello dearies, editing Selase here. I have to jump in because the next part wasn't so clear. So in the salary structures our salary in a way that it's easy to determine the salary that everybody gets, and it's based on your educational qualification. So if you are holding a certificate, the salary structure says let's pay you this amount, okay? And if you are holding a diploma, you get higher amount. If you are holding a degree, you get higher, and masters and all. And also, if we are all holding a certificate qualification, we all get the same base pay. So if it's a nurse assistant, clinical, preventive, a field technician, a medical lab technician or medical lab assistant certificate, all of the certificate programs, you get the same base pay. Nobody gets higher than the other because your job is different from the other person's. No, if we are all holding diploma, we get the same base pay. I'm a nurse, you are a medical lab technician, you are a disease control officer, health information officer, but we all have a diploma. We are all getting the same base pay. The same applies to degree and masters and all. That is how the single spine salary structure is. Then there is a second part of our salary which is called the market premium. So a market premium is essentially an absolute amount paid only to employees with critical skills in short supply. It is paid to attract and retain critical skills in short supply within the economy. The rationale for market premium is to attract and retain critical skills in short supply in the public service in order to enhance service delivery. So the market premium you receive in addition to your base pay is dependent on whether the skills you have is in short supply, is critical, and the government is trying to retain you, give you a nice package so that you stay and not go to the private sector or travel outside the country, okay? But that one is determined by your skills and how we need you, how much we need you. So for example, the market premium for a doctor will be higher than that of a nurse because we have more nurses than doctors. We need more doctors at the lower levels. So the market premium of a doctor is higher than the market premium of a nurse, okay? And the last thing I want to add here is that Characteristics of the market premium. Market premium shall not be part of basic salary. Yes, so that is why the single spine is different from the market premium. And the market premium shall be determined as an absolute amount and not as a percentage of the basic salary. All right. So these are the two major parts of the salary we receive. So if we are all degree holders, we are receiving the same salary, but our market premiums will determine whether I get higher than you. Let's look at the salary structure for 2023, the single spine salary structure for 2023. I've not seen any document that shows the market premium for each profession. So the base pay will have to guide you on what to do. So the single spine salary structure is numbered. So your certificate or your qualification determines where you start from. So when we look at the certificate programs in the health system, they start from level 12L. So like I said, this is biostatistics assistant, and it's starting from 12L, and the entry level base pay is 1,724.59. And with each salary structure, we have steps attached to them, because you can be on the same scale for 2 or 3 to 5 years before you get your promotion. So each year you get a step jump. So then there is a slight increase in your salary. So for step 1, you get 1,724. Step 2, you get 1,753, and it goes on. Then when you get your next promotion, you get to the next level. Okay, so that is this. You see that the 1,720 something, it runs through for community health nurses. That is the nurse assistant, clinical, that is for community health nurses. That's the nurse assistant, preventive, for dispensing assistants, for dental clinic assistants, dispensing assistants, enrolled nurses. Enrolled nurses are nurse assistant, clinical, field technician. Field technician will be the disease control option. Laboratory assistant, the records management is a certificate program at Kintampo. Yes, so that is that for the certificate level. If you do a diploma, then you'll be at salary scale 15. Okay, 15H, because that is where I started from. So let's look at salary scale 15. So here you can see dental technician 15, nutrition technical officer, pharmacy technician, staff nurse, staff midwife. And the staff nurse, it includes the general nurse, the public health nurse diploma, mental health nurse diploma, and then the staff midwife. Technical officer, biostatistics, health information, disease control, they are all in the same bracket. Technical officer, lab, x-ray, orthotics, they are all there. And clinical engineering technologist, and we all receive the same salary. The base pay for the entry level is 2,673.20. Yeah, and then the following year it will jump to 2,718, like that. Okay, for degree holders start from 18L. So let's look at 18L. Biomedical scientists, you get 18L. So your basic pay is 3,384.73. Yes, this, and it runs through for biostatistics officer, dental technologist, dietitian. You can actually pause this part and read through the document. Okay, dietitian, health tutor, okay, nutrition officer, Medical assistants, these ones, they have been changed to, I don't know if they are still in the system, but they are now the physician assistants. So let's look at this. Physician assistants is also on the 18L. Physiotherapist, nursing officer. Okay, you see, so the physician assistant and the nursing officer are receiving the same base pay. Public health officer, the public health officer can be any degree holder in disease control, health information, environmental health, and all. They are all public health officers. The last thing to note also is that every year salary negotiations go on. I'm sure by now you heard in the news that there will be salary increments in the following year. So when it happens, if the salary increment happens, then it will affect all of the base pay again, because negotiations only affect the base pay. These figures will change next year because of salary increase and all of that. And another thing is that every category of employees or professionals in the health system may be part of an association. And these associations also lobby, or they fight for better conditions of service, some benefits for their members. Okay, so for us, like we the nurses, our association is a Ghana Registered Nurses and Midwives Association, and they lobby for us. And so when they lobby for some packages and you are eligible to receive those packages, then that too will be added to your salary. So for example, in Ghana now, we all have a base pay allowance that is attached to our salary. And also in September of every year, we get uniform allowance, which because we have to wear uniforms to work, we are given uniform allowance once a year. At some level, some nurses receive fuel allowance and all of that. So your profession will also determine the other benefits that will be added to your salary, and that can also bring differences between you and somebody else, even though you are both on the same base pay. But if you want me to tell you the whole salary of each professional body, or the whole salary, okay, you said market premium, base pay, and also how much is a physician assistant taking and how much is a nursing officer taking and all of that, I can't do that, because then I'll have to beg people to get their pay slip and all, and we are very protective of the salary we receive. I don't want to go through that stress. So this is just to give you a fair idea of what you can expect when you choose whatever career you want to choose in the health system here in Ghana. I hope this video was helpful. Like and share and subscribe if you've not done that yet. And if you have any more questions, just leave it under the video. I'll clarify if I can. And I'll see you in my next one. Bye.